to see you. It's fun greeting you. Here we are. Good morning and we'll shine.
If a woman is 35 or above and they've lived together up to 6 months and there's no pregnancy, that means something could be wrong. That would need to be checked.
Okay.
Also, the couple are living together, the pregnancies come, but it does not get to term. That also contributes to infertility. The woman gets pregnant and it keeps miscarrying. That as well.
That as well.
Yeah.
Okay. So what about infertility in men?
Yeah, so we look at it as a couple.
As a couple.
Good. When we go down to talk about the causes, then we'll talk about what causes it in women, men, and then some of the factors are actually combined.
Combined factors.
Right.
Okay. But infertility in women, can we say that, if I should go in for these contraceptives, maybe, for instance, I learned there was a couple that went for that option. So they weren't having children, obviously they weren't having children for some time. But after she took it off, it took quite some time, before, I think about a year before
the pregnancy
she was able to
came.
conceive. So in that period, she was infertile?
It could be, yes.
Okay.
And it wouldn't necessarily have to do with the fact that she has used the IUD.
Right.
She used the IUD because she wasn't ready at the time. Maybe if she had started trying immediately, the problem would still have been there. It would have been detected and then sorted out.
Okay.
So it's just that it can happen in any couple. But there are some people who are at a higher risk than others. Yes, so the use of IUD does not make a woman infertile.
Right.
The period a woman has it, it prevents unwanted pregnancy. Once you take it off or out, there's what we call return to fertility. It's immediate.
It's immediate.
Yeah.
It's immediate.
It's immediate.
So in the case where it's not immediate,
So immediate means that once we take out the IUD, you are returned to your normal function.
Right.
So if everything is okay, it is possible to get pregnant that very month.
okay.
If you don't get pregnant that very month, now mind you, for a couple staying together with no problems with the man or the woman, there is a 1 in 4 chance of pregnancy occurring every cycle of menstruation.
Right.
Okay, so once there is no problem, return to fertility is immediate. If there's some other issue, it might take a little longer. If it's taking beyond 6 months to a year, there's definitely the need to get seen and then investigated. Yeah.
Okay. All right. So, what are some of the causes of infertility?
Infertility, right. So, infertility has become a big issue because in our society, and actually also in many societies, people tend to look towards a woman as though she's the cause of the problem. And to the extent that it begins to lead to stigmatization,
Exactly.
and that imposes a lot of burden, psychological and emotional problem for the woman, which is quite unfair. Because if you look at the causes of infertility, nearly half of the problems are from the man as they are from the woman.
Right.
Because strictly speaking, we say about 30%, in 30% of cases, the cause is related to the woman. Right. Another 30% is related to the man. And the next 30% is combined, both.
Okay.
And for a small 10%, the cause is actually unknown.
Okay.
So it's extremely unfair when everybody
Blame is shifted on
exactly on the poor woman who is also at the receiving end of all the stigma and all of that.
Yeah. So then, what do we do then? Because it seems like it is still the case.
It is.
The fact that everybody knows.
Yeah.
It could be.
Yeah, I mean, not a lot, which is why forums like this are important. So we let it out there that when a couple are living together and there is difficulty conceiving, it is not necessarily an issue of the woman. It could be the man alone. It could be the woman alone. It could actually be a bit of issues from the man and a bit from the woman as well. Okay. Now, so when we look at the case of the woman. Now, in the female reproductive system,
Okay, let's have a shot of this.
this is the woman's reproductive system,
Right.
the womb. Okay.
This is the womb.
Yeah, this is the womb. Now, the womb here has the inner part
Okay.
where the menstrual flow comes from. Okay, it comes from here. And how does it come? Every month, the woman is supposed to release an egg from the ovaries. So this month it comes from here, next month it goes from there. And so sometimes when there is ovulation, that's the release of the egg, there is some tiny bit of bleeding here, and that causes some mild lower abdominal pain in the woman, which may be to one side. So the egg released needs to travel down what we call the fallopian tube. Okay? So as the egg is traveling down, when the woman has unprotected sex, the sperms are released here. So these sperms need to be in a good number, and they need to have the ability to swim up, enter what we call the cervix, travel through the womb, and then meet up with the egg to fertilize it. Then the fertilized egg, now we call embryo, would travel down, come and settle here, starts growing, becomes a baby. After 9 months, come out, and then we have the celebration. Right. So that's what happened. So for the couple to have difficulty conceiving, in terms of the woman, is it an issue of the ovulation not happening well or regularly or at all? Is it an issue of the tubes? And in our environment, the tubal factor is a leading cause of infertility in women. The tube is either blocked by something inside or something from the outside. Is it an issue of a problem relating to the inside of the uterus, the womb, or the womb itself, commonly fibroids in our environment?
Okay.
Or is it a matter of the sperms not being able to swim up because they are weak as a result of something the man is doing or not doing right, or the number of sperm cells are too low? Okay, so then in order to find the cause, we investigate along these lines. Then we figure out where the problem is, we deal with it, and then the problem is solved.
The problem is solved.
Yeah.
Okay, great. Now, in the case of, let's talk about the women first. In the case of women, things like growths and fibroids can prevent, and tubal blockages can prevent fertility. Now, let's talk about the things that we are doing wrong, or we may not be doing right. That causes, yes.
So, in the case of the tubal factor, like I said, the tubal factor is the leading cause of infertility among women in our environment, and mostly it's just because the women get infected. Okay, there's a whole host of bacterial infection that, you know, the vagina naturally has some collection of bacteria. And so for the woman who is sexually active, some of that would go up and then gets to grow in the tubes. Okay? And then, so if that is not detected and treated, it stays there for long, it damages the tube. So the tube gets blocked. Okay? Occasionally it affects the tube and comes down into the lower abdomen. Then it is severe, then the woman will then come to hospital complaining of lower abdominal pains. But if it is starting, you are likely to have some vaginal discharge, which is abnormal. Every woman experiences some discharge at some point. But a discharge which is of concern, it tends to be a bit more in terms of the quantity. Okay? It's enough to make the woman uncomfortable. Right? And then it is colored, either thick, whitish, creamish, yellowish, greenish, brownish. That's abnormal color. Right. The normal discharge is usually clear, or just a little bit cloudy. Right. Anything beyond that, the woman, you're not able to tell what it is. So the best is to seek care. Then we check it as, okay, this is normal, no problem. Or no, there's an infection. Take ABC to take care of it. Okay? Or the discharge has some unpleasant smell, then there's a problem. Okay? Sometimes those infections can manifest as severe pain during the menses. Or during sexual intercourse, the woman gets a lot of pain. Those may be indicators that there is something wrong. If it's not from an infection, it could be some other problem, which definitely would need to be investigated and sorted.
so that brings me to menstrual pain and menstrual problems
Yeah.
and all that.
Yeah.
If you have so then that's the reason it's important to go see the doctor,
Yeah.
because it is not always that you have extreme menstrual cramps.
That
there's
is normal,
something wrong.
right?
That is- yeah.
Yeah, because what tends to happen is, you see, like I said earlier on, the menstruation is basically, from what I described earlier, when the ovulation is happening, naturally the womb is primed to prepare that, hey, there's an egg release
traveling, yeah.
which is going to be fertilized, so get ready to receive a pregnancy.
Yeah.
So the womb prepares itself, and the preparation is that the inside gets a little bit thickened so that the embryo can sit in and implant beautifully.
Okay.
And so if there is no such fertilization, that preparation has to be shed off. And that is what flows out as the menstrual flow.
Okay.
Okay? So naturally, it should just be a smooth flow with something not more than a mild cramp.
Okay.
Okay? But when there is severe pain, it could be that there is fibroids.
Okay.
I'm going to show you the photo of the fibroids in a bit.
Right.
Okay? It could be that there are fibroids that have grown in the womb or in the uterus. The fibroids could be parts in the wall of the womb pointing more to the outside.
Yeah.
Some are exclusively within the wall. Some are in the wall but pointing more to the inside.
Yeah.
Okay? This, for instance, and this one is most exclusively into the inside of the uterine cavity or the womb. So this and this would definitely cause menstrual pain.
Okay.
Okay, quite apart from that, this, that, and this, if they existed without this, you're also likely to have some abnormal menstruation.
Okay.
Sometimes the fibroids will make the woman bleed. You have the regular flow. You're expecting the next one at this time. Then you bleed in between.
Okay.
It's not normal.
It's not normal.
It's not normal.
Right.
Okay. The average woman has a menstrual cycle of about 28 days. For us, if it's between 21, some people have short cycles.
yeah.
If it's 21 all the way up to 32, it's normal. Anything within that range.
It's normal.
A few people may get up to 35.
Right.
No problem. But it should bleed and bleed within 2 weeks. That is definitely abnormal.
Abnormal,
That would need to be investigated. And one of the causes of that could just be fibroids.
One of the causes
Yeah,
is fibroids.
okay.
Okay.
Sometimes women also have cervical cancer, which we spoke about a great deal in the month of January. It also causes some of that abnormal bleeding. Either the bleeding is becoming excessive compared to what it used to be,
Right.
or it is now bleeding every 2 weeks.
Okay.
Okay, or the woman bleeds during sex.
Okay.
It could be that there's something wrong with the cervix. Either it's an infection or cervical cancer.
Okay. But there are some certain cases where perhaps, okay, let me use myself as an example. Maybe I am like clockwork. It's every 28 days.
Right.
No more, no less.
Right.
28 days, the flow must come. Okay. I don't have fibroids because I have been checked.
Right.
I don't have any fertility issues because there have been scans and everything that shows that I am okay.
Right.
But the menses is still so painful.
Right.
Is there something else that is going on?
Yes, like I said, it could also be painful menstruation.
Right.
It's just in a few women
Right.
that there is no cause for it.
Okay.
But in the large majority, there's a reason why.
There's a reason.
Yes. And if it's not fibroids, it could be a pelvic infection. Or there's another common problem we call endometriosis. Exactly. In endometriosis, what happens is that the cells that are supposed to be found inside the womb, where the bleeding comes from, those cells have migrated and abnormally located outside the womb.
Okay.
Okay. So you can imagine that the cells that we call endometrial tissue, instead of being exclusively here, some are outside the womb. Sometimes they are within the wall of the womb. Sometimes they are on the ovary.
Okay. I think we should make. Yeah. This is better. Okay.
Good.
So right.
So some of these cells that are supposed to be inside here are found on the outside of the womb.
Okay.
Some are on the tubes. This causes a lot of inflammation, and in a long term, they can cause blockage to the tube.
Okay.
some are right in the ovary here. So all these abnormal occurring cells outside the womb, what happens is when the woman is in her flow, as she's bleeding from here, all these are also bleeding wherever they are.
Okay.
You see?
Yeah.
So that blood is going to go into the lower abdomen. It irritates the abdomen. It will manifest as severe pain during the time of the menses. Okay. Occasionally, this leads to the formation of a cyst in the ovary. And that cyst, you can imagine, it's like a balloon within the ovary that is contained repeated collections of menstrual blood. Okay. So when we do surgery and we take it out or we drain it out, it looks like a chocolate drink. You can imagine blood that has been there for a long time. So we call it chocolate cyst. So in some people, the problem is endometriosis, responsible for severe menstrual pain. And it comes either a few days before the flow or during or a little after. Yeah.
But for a few people, the cause is unknown.
For a few people, there's nothing you will find.
Okay.
It's just the uterine activity, which is a natural response.
Okay.
That's in the minority.
That's in a minority.
Yeah.
Okay, great. Because I find that for certain women,
Yeah.
after experiencing all these things and being to the hospital for pain and being given painkillers and all of that, after childbirth,
it gets better.
it gets better.
In a large
It goes on.
majority of those,
Yes,
that happens. Yeah.
Okay, great. Now, lifestyle choices or things. What are other things that we do apart from the fact that there are growths and things that what are causing those things and making us not?
Yeah. So the main issue is what we call the health-seeking behavior.
Okay.
You know, because if you notice something abnormal, a lot of people would sit back and not do anything about it. And the problem is getting worse.
Yeah.
In the first place, you are not even sure exactly what it is. Okay, so that has been the main issue. Because if only the woman would come forth early, that I've noticed this abnormal discharge, or these days I feel a bit of pain during sex, or my menses were previously not painful, it's become painful now. Then we can get it checked.
Right.
Oh, it's a pelvic infection you have. Let's deal with it. It's a problem with the cervix. It's a growth on the uterus. It's a fibroid. It is this. It is that. Then we deal with it early. Okay. And most of that can be done without necessarily having surgery. You see, but the longer you wait, then the risk of surgery becomes an issue. Then sometimes the bad practices, the douching that the women do, you see, because we say naturally the vagina has a self-cleansing mechanism. Right. So the tissues, the cells there produce some secretion that keep it clean. And there's different groups of bacteria. Some are producing acid, some are producing the alkaline content, so that there's a balance. So once you do your douching, start introducing the soaps and whatever to do the douching, you distort that balance. And then one group of the organisms or the bacteria will start growing more than the other. Once they start growing more, then they move up into the womb, down the tubes, and that's how the problem begins. So no woman should do the douching.
Okay, you heard it from doctor himself. Sometimes I have said it here that it's unnecessary to
Absolutely not necessary.
It's unnecessary to. It's in there for a reason. So just clean the outer part of it very well, and you'll be okay. You'll be okay because it cleans itself. Got it. All right. Okay. So that. So what do we do as women? We should avoid some of these practices. And
then report early.
Report early to the clinic when you see a problem. All right. So now let's come to our beloved golden men.
Good. Beloved and golden.
Beloved and golden.
I must also say that in the case of the women, sometimes there are some hormonal issues.
Hormonal
issues. That's also very important. And we tend to see a lot of that as well these days. And then most of the hormonal issues affect ovulation. We've spoken about the womb itself, fibroids. We've spoken about the tubes relating it to infection. In terms of the hormones, there's a common problem we call polycystic ovarian syndrome. Now, how that happens is that instead of the ovary in a normal function, releasing one egg a month, in the case of the polycystic ovarian syndrome, you have so many tiny growths that are like cysts within the womb. And so none of them really matures enough to release the egg.
Okay.
So as a result, the woman does not release eggs. The woman does not ovulate.
Okay. She doesn't ovulate.
She doesn't ovulate. So what happens is most of them will not see their menses. So 2-3 months, no flow, then another flow will come. Typically, if it misses 1 or 2 or 3 months, then it comes for a little longer. Most of them would even have to come to hospital to take medication to stop it.
Okay.
And then, as a result of that, once there's no ovulation, fertilization does not happen, pregnancy does not happen. Okay. The real cause of the problem is genetic. You are born with it.
You're born with it.
You're born with it. But then it's up to you to see that I'm not getting monthly flows.
Okay.
Let me get checked. Okay. Being born with the tendency to have that, if the woman is obese, it makes it worse.
Okay.
So most women with that problem, we would say, shed a bit of weight. No matter when we meet and then we have the discussion, and we confirm that if you lose up to 10% of your weight, things get better.
They get better.
They get better.
Wow.
Okay. And typically, because the ovary has become so thickened with those small cysts, the ovary looks bigger and tends to produce a lot more of male hormone.
Right.
Okay. And so those women tend to have beard. Do you have beard?
Oh, okay. Today is not the day to talk about but what I have.
Right. So those women tend to be a bit more hairy.
Okay.
Yeah, they are hairy.
Yes.
A bit more than the average woman. Hair on the chest, they get beard. Some have beautiful mustache.
That's a beautiful mustache.
So most of that is likely as a result of what we call polycystic ovarian syndrome.
Wow.
Not everybody with that problem would have problem with infertility, but a large majority would have difficulty conceiving. Okay. Sometimes too, the other type of the hormonal problem is there's a hormone which releases breast milk.
Okay. Yeah.
And that comes from the brain. And for some reason, a woman's brain is producing excess of that hormone. That's supposed to only be high when you have a baby. To breastfeed. So when you're not breastfeeding and that hormone is high, it also suppresses ovulation. And then when you squeeze, you see that there's milk coming.
Wow.
And that is a problem as well. Because it doesn't make you ovulate. We investigated, is it something that requires medication? Yes, we give medication to suppress it. You're good. If not, very occasionally, there's a growth in that part of the brain that might require some surgery to deal with.
That is incredible.
Yeah.
Okay, who knew that problems with the ovaries have to do with the brain and all that?
Yeah.
Quick one. You know, there are women who also give birth and then they are not able to produce breast milk. Does it have anything to do with that?
Yes and no.
Okay.
Yes, because some women, if during or soon after birth, they bleed excessively. Okay, what we call postpartum hemorrhage. Right. Or obstetric hemorrhage. They bleed so much that blood supply to that organ in the brain which produces that hormone prolactin is affected. It affects lactation. Okay. Right. Okay. But a large majority of women having difficulty lactating just may have to do with stress.
Stress. Or diet?
Diet, maybe to a small extent, but it's largely stress.
It's largely stress.
You know, especially for a first-time mother who is not really so used to the thing. Baby is crying, husband needs to get help, the woman is stressed, can't sleep well because baby is crying every 2 to 3 hours. You need to wake up and attempt to breastfeed, and the milk is not flowing, you're not getting good rest. Right. All that imposes a lot of psycho-emotional stress on the woman, and definitely that affects lactation. So when you get help, then that eases the problem.
Okay, all right, great. So in all of this, what I'm getting is that as soon as you see red flags, you see any of the symptoms that show that there may be a problem, you run to your doctor and then have yourself checked. Okay, so can we move to the men now?
Yes, I see you're so interested in moving to the men.
Oh, well, yeah, we talk about the women a lot. Today, let's talk about the men a little bit. It's allowed.
Yes, why not? So in the case of the men, the commonest problem would have to do with bad sperm.
Bad sperm.
Okay, right. And the sperm production happens in the testes, which are the two little balls inside a sac we call the scrotum. Right. Okay. Now, the testes or the scrotum is supposed to, the testes are supposed to work normally when the temperature they are within is lower than the body's temperature. Okay. Which is why the Almighty Creator put
Yeah.
the testes outside the body,
Outside, yeah.
in the boys' quarters there, you know.
Yeah.
So, if for some reason the testes get exposed to so much heat,
Okay.
then it will affect sperm production.
Right.
And that tends to happen a lot in people who do long distance driving.
Right.
You see, besides the commercial driving,
Drivers.
where most of the minibuses, the engine is in the front, so the driver's seat is really on the engine.
So there's a lot of
A lot of heat. A lot of heat. Or the man who wears very tight underwears. You see, when you wear very tight underwear, like the briefs, it holds the scrotum onto the body.
Okay.
And we don't want that.
It has to be
The
free.
boxer shorts leave a bit of room. Or they work in an environment like some factory where there's a lot of heat. All
Okay.
that in the long term would affect the sperm production.
Okay.
Occasionally, those who get exposed to a lot of hot water,
Okay.
that also, because it's about consistently doing the same thing. Okay, so that heat exposure causes a lot of damage. Okay, so the sperm production doesn't happen. So when they come and we do the semen analysis, the count is low. The movement of the sperms to very low.
Okay.
And a lot of the sperms are formed, but they are abnormal.
Okay.
One has 2 heads, one have no tail.
Oh, wow.
And then they can definitely not do fertilization.
They can't fertilize.
Occasionally, they go fertilize the egg, but it is abnormal.
Okay.
So nature would clear them out. So the woman gets pregnant,
Pregnant
and
and
then
then has a
miscarries. Yeah.
Oh, okay.
And it will be happen repeatedly
Right.
until things get sorted.
Right. Right.
Okay.
Right.
Sometimes exposure to other forms of radiations in the men. These days we talk about people who carry their laptop on the lap
the
as
lap.
well.
Okay.
You know, there's some radiations you cannot see, quite apart from the heat, and we are beginning to suspect that that is
can
also having
affect
some
that.
effect. Yeah.
Wow.
Okay.
Okay.
Apart from that, some men have a problem where there's so much blood flowing around the testes, which is abnormal. You see the veins we have here, you have so many of that around the testes. There should be just a few.
Just a
But
few.
some people have
A
excess.
lot more. Okay.
We call it varicocele.
Okay.
And
Is
that-
it a disease or?
It is an abnormality.
It's an
For
abnormality.
instance, if you look at mine, you can see mine is thick
Yeah,
here. Yours is not as thick. So
Yeah.
just the individual differences.
Okay.
So the same way, somebody can have the excess of that around the testes.
Okay.
And so blood is what keeps us warm. So there's so much blood there.
So
the
there's
place is going
warmth,
to get
it's
too
too
warm,
warm.
for the sperm, for the testes to function properly.
Okay.
And that affects sperm production.
Sperm production.
Okay.
What about those who are? And because I've heard that there are some men who are not able to produce sperm at all.
Yes, but that is not very
Common.
common. But
Right.
what happens in those cases is that, before I get it, so
Okay.
in the case of the varicocele,
Right.
once we detect it, there's some minor surgery we do,
Okay.
fix it,
Okay.
and you're sorted. Now, in some men, the testes produce the sperms all right, but it does not get to leave the testes and come out.
Okay.
Okay, that's what you're talking about.
Yes, yes.
So we call it obstructive exospermia. You don't need to try to repeat it.
Okay.
You might bite your tongue
I might do that
before breakfast.
Yes. Let's
So,
not do that.
Yes. So the testis working okay, but there's a problem in the pipe that carries the sperms from the factory through to the outlet.
Okay.
So that blockage makes the sperms difficult. So they are stuck inside the testis. So when the couple would come and we check and we see this is what the problem is, then we have to do a form of advanced treatment where we call it IVF. It's one of the reasons we
Yes,
do IVF. We'll be
IVF.
talking about it in a bit. But in that case, we have to do some tiny surgery when the woman's eggs are ready to extract the sperms from the testis directly and use it to fertilize the egg.
The egg. Okay.
Then we grow the pregnancy, then put it back in the womb of the woman.
Of the woman to carry.
Yeah.
Okay. Right.
Yeah.
Okay. So still on the causes of some of
The men, yes.
The men, yes.
And sometimes the issue of erectile dysfunction, where the man is unable to achieve erection, which is able to have satisfactory sexual activity. So as a result of that, they're able to get an erection, so they can't have penetrative sexual intercourse, and then release the sperms there for us to go fertilize the egg.
The egg. Okay. What about in cases where where previously in a man's life he's also had infections like gonorrhea or certain illnesses that he's not been able to treat well?
Yeah.
Or haven't completely
treated at all.
Yeah.
Yeah. Yeah, so some of that would also cause part of the blockage I spoke about.
Right.
In the conduct or in the pipe that brings the sperm.
Okay.
So those infections can cause that. They can actually also cause a total shutdown of the testes, and they won't be able to produce sperms at all.
Okay.
And in those cases, we may have to consider the use of a donor sperm. When a couple comes and we investigate and we see this is a problem, your testes have frozen, infection has finished them. It's just like the testis is just like a scar tissue there.
Oh wow.
Then the only way out is to consider the use of another person's sperm to fertilize your wife's eggs for you.
And that's done?
Yeah, we do that.
Okay.
You explain to you. You have to, you understand it and you sign up for it.
So you get to choose the person who you want?
Yes, yes. We look at your profile. You are tall, you are dark, you are middle height, then we get a matching donor. Occasionally, somebody would insist on using their brother or their cousin, and so we go that way. And everybody signs up to it, and then we go ahead.
And then you go ahead and do it. Okay. All right. So we've talked about the we know what it is. We talked about the causes, and then now symptoms. Okay.
Yes. So basically, it's the inability
to conceive.
That's it.
As soon as you realize that you haven't been able to conceive, you run to your doctor.
Yes.
And then you have yourself checked. Okay. So now let's come back. Let's come to what we can do then.
Right.
Yeah. What we can do.
Good.
In cases of infertility, you just spoke about the IVF as one of the options.
Yes. So in the majority of cases, once we find a cause, if it's an issue of an abnormality with the inside of the womb,
right,
we deal with that. If it's an issue of fibroid, which is the growth, like I mentioned, disturbing the inside of the womb or putting pressure on the tube, not allowing the uterus to function properly, we do the surgery called myomectomy to remove the fibroid.
Fine.
It's not a big deal.
It's not a big deal. Okay.
We do surgery. Within 3 months, the womb has well recovered, ready to take on pregnancy.
Doctor, can you please tell them that there's no medicine that will melt fibroids?
Thank you.
Okay.
So, like I said earlier on, these fibroids are growths within the womb.
Yeah.
Okay, they are growth. They are solid. They are growths in the womb at various parts.
Right.
So they are abnormal growths that would have to be removed, taken out.
Okay.
There's no amount of medicine that you can drink, apply on your tummy or bath or insert to melt these fibroids. Unfortunately, we get women who have been told they have fibroids. We need to do surgery to solve your problem. They disappear. They say no. They go drink all sorts of concoctions
that cause
for months.
other problems.
The thing is growing bigger, and you don't know what those concoctions, herbals contain. Begins to affect your kidneys, your liver. You're getting other problems.
Yeah.
Unfortunately, a few of them would even insert some of the herbs. You know, we've seen a few cases where they've inserted the herbs, and the herbs are so strong they have caused irritation in the vagina. The vagina is so inflamed, it heals, and the vagina is stuck together. We have to now, so vagina is stuck together, you can't have sex, you're not getting your menses. We have to plan surgery to go and reopen the vagina.
Oh my God.
Now, before deal with the fibroid, before getting to the infertility itself.
Okay, so you heard it here yourself. Okay,
You know,
I always say that you should not buy herbal medicine on the go. There are some that are good, but you should not buy them on the go. Contact those who are approved.
Yes, who do scientific research into the herbal stuff.
Exactly.
You see, because you may be drinking the herb for one reason, you don't know what other damage it's causing.
It's causing.
That's the thing. Okay, and so there's only a few cases that we give some injections where we think the fibroids are so huge that when we're going to remove them, there may be too much blood loss.
All right.
So we give injection just to stop their growth a little bit, not to remove them. So that makes the surgery a bit less bloody.
Okay.
That's all.
That's
Even
all.
that, you take the injection 1, 2, 3 shots, then we go in and do the surgery. Once we stop taking the injection, the growth is back to normal.
All right.
So it's not even a cure that in itself. Okay. Good.
Okay.
So if it's fibroids that are been identified as the cause, we deal with the fibroids,
Right.
and then you are good.
Okay.
If it's an issue of ovulatory disorder where you're not ovulating,
It's dealt
either
with.
from the polycystic ovarian syndrome, which is the commonest cause, we investigate, give you medications to deal with the hormones, and then give you some other medication that would make the woman to ovulate.
Okay.
And then we say, take this medicine from this day of your cycle
To that day.
for this day, number of days, and then have sex from this number of days, and
Okay.
then pregnancy comes.
Whoa, okay. So there's a plan. A plan will
A
be put
plan
in
for
place.
that.
Okay, so
Good morning to you. It's so nice to see you. It's fun reading